Abetalipoproteinemia is rare disease. It is autosomal recessive in inheritance that interfere with the normal absorption of fat and fat-soluble vitamins. It is caused by mutation in microsomal triglyceride transfer protein, resulting in deficiency in apoprotein ApoB48 and ApoB100, which are used in synthesis of and exportation of chylomicrons and VLD respectively. You already know ApoB48 in transportation of chylomicrons, and ApoB100 helps in what? Transportation of VLDL. No, it is not to be confused with familial dysbeta-lipoproteinemia. Familial dysbeta-lipoproteinemia is type 3 hyperlipidemia, in which VLDL LDH is elevated. Abetalipoproteinemia affects absorption of dietary fats, cholesterol, and certain vitamins, A, D, E, K vitamins. People affected by this disorder are not able to maintain lipoproteins, which are molecules that consist of proteins combined with cholesterol and particular fats called triglycerides. Did you get it? People who are affected by abetalipoproteinemia cannot make lipoproteins. No? Then lipoproteins are molecules that have proteins and cholesterol and triglycerides. You may already know about lipoproteins. This lead to multiple vitamin deficiency affecting A, D, E, K vitamins are not absorbed. However, many of the observed defects are due to vitamin E deficiency in particular. Point to be noted. Vitamin E deficiency in particular. Many of the observed defects. The signs and symptoms of abetalipoproteinemia appear in the first few months of life because pancreatic lipase is not active in this period. Again, I am repeating this sentence. The features of abetalipoproteinemia appear in first few months of life. Why? Because pancreatic lipase is not active in this period. They can include failure to thrive, diarrhea, abnormal spiny red blood cells, acanthocytosis. You can see here picture of acanthocytosis. No, acanthocytosis. These are projections. No, these are projections, spiny projections arising from. This is to be not confused with Bohr cells. Bohr cells in uremia. These have many spiny projections, but they had Bohr cells, not spiny, rounded type of projections and less. Okay, now come here. And fatty steatorrhea, fatty smelling, foul smelling stool. The stool may contain large chunks of fat and blood. Other features of this disorder may develop later in childhood and often impair the function of nervous system. They can include poor muscle coordination, difficulty with balance and movement, ataxia, and progressive degeneration of the retina that can progress to near blindness due to deficiency of vitamin A retinol, because vitamin A is not absorbed. Adults in their 30s or 40s may have increasing difficulty with balance and walking. Many of the signs and symptoms of abetalipoproteinemia result from severe vitamin deficiency, especially vitamin E deficiency. Vitamin E deficiency, which typically results in eye problems with degeneration of spinocerebellar and dorsal column tracts are degenerated due to deficiency of vitamin A. Now symptoms. Often symptoms arise that indicate that body is not absorbing or making the lipoprotein that it needs. These symptoms usually appear in mass, meaning that they happen all together at all time. The symptoms are as follows: failure to thrive, failure to grow in infancy, steatorrhea, frothy stools, foul smelling stools, protruding abdomen, intellectual disability, developmental delay, developmental coordination disorder, evident by age 10. Muscle weakness, slurred speech, scoliosis, progressive decreased vision, balance and coordination problems. Signs. I have already shown a picture of acanthocytosis and also retinitis pigmentosa, hypocholesteremia because cholesterol is not absorbed. The initial work of abetalipoproteinemia typically consists of stool sampling, blood smear and fasting lipid panel. Though these dates are not confirmatory as the disease is rare, the genetic studies is necessary for diagnosis is generally not done initially. Acanthocytes are seen in blood smear. I have already told you. Since there is no or little assimilation of chylomicrons, their levels remain low in plasma. The inability to absorb fat in the ileum with result in steatorrhea. or fat in stool. As a result, this can be clinically diagnosed when foul-smelling stool is encountered. Low levels of plasma chylomicron are characteristic. There is an absence of apolipoprotein B. Intestinal vacuoles containing lipids are seen in enterocytes. This disorder may also result in fat accumulation in the liver, hepatic steatosis, because the epithelial cells of the bowel lack the ability to place fats into chylomicrons. Lipids accumulate at the surface of the cell, crowding the functions that are necessary for proper absorption. Now, genetics. Mutation in microsomal triglyceride transfer protein gene has been associated with this condition, apolipoprotein B deficiency. A related condition is associated with deficiency of apolipoprotein B. Here you already know autosomal recessive inheritance. MTPP gene provides instruction for making a protein called microsomal triglyceride transfer protein, which is essential for creating beta lipoproteins. These lipoproteins are both necessary for the absorption of fat, cholesterol, and fat-soluble vitamin from diet are necessary for the efficient transport of these substances in the blood stream. Most of the mutation in this gene lead to production of abnormally short microsomal triglyceride transfer protein, which prevents the normal creation of beta lipoproteins in the body. Did you get this point? Most of the mutation lead to production of abnormally short microsomal triglyceride transfer protein. Short, which prevent the normal creation of beta lipoproteins in the body. The MTPP associated mutations are inherited in autosomal recessive pattern, which means both copies of it must be faulty to produce the disease. Now, how do we treat abetalipoproteinemia? Treatment consists of rigorous dieting, involving massive amounts of vitamin, oral vitamin E, massive amount. Vitamin E helps the body restore and produce lipoproteins which people with abetalipoproteinemia lack. Vitamin E also helps keep skin and eye healthy. Epithelial generation. Studies show that many affected males have vision problems later in life. Developmental coordination disorder and muscle weakness are usually treated with physiotherapy or occupational therapy. Dietary restriction of triglyceride has also been useful. And prognosis of abetalipoproteinemia. If it is treated early in disease, neurological sequelae may be reversed and future deterioration can be prevented.